Okay, well, my name is Padraig Egan. I'm here with Fitzpatrick Referrals. I completed their internship program about 6 months ago. I embarked on an internship after about 4.5 years in practice, which is not the usual kind of pathway to take. People regard internships as something that new graduates take on, that new graduates use it as kind of an exercise to increase their skills and prepare themselves for life in general practice. I kind of did it the other way around. After 4.5 years in practice, I wasn't really finding fulfilment in what I was doing, and decided that small animal surgery was a real passion, what I loved doing, and to become a specialist in that area I needed to consider going down the route of a residency. To gain access to a residency, the prerequisite is an internship. So instead of focusing on a general rotating small animal internship, I decided to try and focus on an internship that revolved around surgery, and that's where I found myself at Fitzpatrick Referrals. I did a 12-month internship with them. In that period I managed to present clinical research abstracts, present posters at BSAVA. I had a research abstract presented at VOS in America. Managed to get a paper published, quite strangely, on sheep, but you don't expect that in a small animal practice, but we managed it. And to me, most importantly, managed to scrub for 450 cases. It confirmed within me that surgery was the path I wanted to take in my career, and really was one of the best decisions I've made career-wise, and reignited within me my passion for veterinary medicine and surgery, and I'm just glad I made the decision, even though it was a little bit late. I think before I embarked on an internship, I was very careful about what it was going to entail for me, being a little bit further out in my career. My experience was, in the main, wholly positive. I learned an incredible amount. I was given the ability to work under some world-recognised specialists, gain knowledge from them, expand my own skill set. It's not all a bed of roses, there are some negative aspects of it that anyone thinking about going down the route of an internship should consider, but I'd prepared myself quite thoroughly, I thought, before I started. The wages aren't great, the hours are long. It can at times feel that, especially for myself after being qualified for a number of years, that you're being told what to do instead of making the decisions for your own patients. But you learn very quickly that by following the direction of people that are more experienced in a field, you can improve your own ability to look after patients. And for me, I can see internships as a kind of stepping stone, not just for people that want to do residencies, but for people that are in general practice and want to find a way of expanding their skill set very, very quickly. 12 months isn't a long time, and I can see that if I'd moved back into general practice after doing an internship, it would have been incredibly useful for me. I think when choosing an internship, you first have to have a little think about what your career goal is going to be. I think there's certain questions you need to ask yourself. Will a private practice or a university-based internship suit you better? I think they're both wonderful opportunities, but it comes down to the individual. I think maybe newer graduates might be better placed considering some of the university settings where the support might be a little bit more structured, and there might be more individuals there who can offer support. Private practice can be a different entity. I think people need to visit the places they're going to consider doing an internship at, get a feel for it, see is it the right place for them to work. Every practice, every university is different. You need to decide if you're going to commit 12 months of your life to something that you can fit in, that the workflow's right, that the people seem nice. I visited a number of places before I settled for Fitzpatrick's for my internship, and I just made sure that if I was going to make that sacrifice of 12 months of my life to have lower wages, longer hours, that it was the right thing for me.